So I have always been interested in finding new ways and methods to help my patients get better faster. So other continuing education that I've done is Wilbarger's brushing protocol. Then I also did yoga for special children, sensory integration. I have also learned about interactive metronome. Um, I also did the sunrise program. Hello. And MNRI, and now latest is QRI, quantum reflex integration. And I'm really very impressed with this therapy because I see improvements in my patients very fast. It's a very effective and efficient method. And it is easy for the patients to participate in because they don't really have to do a lot of exercises or something while I'm working with them. So it's very easy to get their participation. All right, so now I will share my screen so that you can see the presentation. And also I wanted to let you all know that if you have any questions, please write them down in the chat box so that we can get to them. I will answer them at the end of the session, okay? Okay, can everyone see this? Okay, so QRI, quantum reflex integration, it is the primitive reflex integration using low-level laser therapy. So what I'm going to talk about today is, first thing will be what are primitive reflexes and what happens when primitive reflexes are retained or unintegrated. Then the conditions that are treated with QRI, what is QRI, of course, and then some parents have come here to share their experiences with QRI. And then we will have the question and answers sessions. So primitive reflexes are automatic involuntary reactions or movements that come because of stimuli like touch, sound, movement, or temperature. And these reflexes are in the brainstem, in the lower level of the brain. They are also known as infant reflexes or neonatal reflexes because they appear at birth and they are supposed to be integrated by the time the child is a year old, and one or two reflexes by the time the child is 3 years old. These reflexes develop during pregnancy of the mom, and many of them appear after birth. Some appear at birth. So primitive reflexes are very important for the children, for the kids, because they support the movement of patterns in the womb and also after birth during the early months of life. They play a key role first in allowing the fetus to go through the birth process, through the birth canal. The Moro reflex, the ATNR, the Bowel crawling, spinal parese, spinal gland, all of them work together so that the infant is born naturally. And then after birth, these reflexes help the infant to develop higher brain centers that control muscle tone, movement, sensory integration, cognition, learning skills, everything. And so this is like an inverted U. So one reflex will appear, then it keeps on working in the infant and the strength keeps on rising. And then slowly, as the infant develops voluntary control over that action, the reflex gets integrated into the system and it disappears, but it is still there in the system, but it does not work anymore. So every reflex, there are about 20 reflexes. Every reflex comes at a set time, it does its job, and it disappears and helps the child to develop maturity and all the different movements and actions. Now, what happens if these reflexes don't integrate appropriately? So I have a few reflexes here, and I will just tell you about them. So first is the Moro reflex. And the purpose of this reflex is the primitive fight or flight reaction. So the primitive reflexes are also very important for survival of the infant. So at birth, the child is totally helpless, but the Moro reflex is there. If there is a sudden movement, sudden light or something, if the child is falling, then the Moro reflex comes in and it helps the child to um, automatically go into extension. And the second is to hold on to whatever is around there and be safe. So that is how the Moro reflex works. But it is supposed to get integrated by 2 to 4 months of age of the baby. But if for some reason it doesn't get integrated, then what are the signs that we see? We see hypersensitivity, hyperreactivity, poor impulse control, sensory overload, social and emotional immaturity. So if there is like a bright light that suddenly comes, that will elicit the response of the Moro reflex. And so the Moro reflex is what has helped the infant with the first breath when he's born. So they go into extension and they might cry, or they might go into the fight or flight reaction after 4 months, even if the reflex is still there. And in older kids, we see it as hypersensitivity to sound, like they can hear a car far away and they can still hear the sound while we don't even notice it. And even higher frequency sounds they can hear because they get very hypersensitive to sound. Tactile textures, of course, they're very sensitive to that. And we also see allergies and chronic illness because the fight or flight reaction releases adrenaline in the body. And that really fatigues the immune system. And these children are more prone to catching infections, falling sick. And in the behaviors that we see with the retained Moro reflex, they might have panic attacks, mood swings, there might be aggressive outbursts. And then the rooting reflex is the automatic response to turn towards food. So it helps the child to feed itself. Okay, for breastfeeding, we see that in the infant. They appear at birth and are supposed to get integrated by 3 to 4 months. But if the rooting reflex is retained, it is not integrated even after 4 months, then we see that in the child who is very fussy in eating or sucks the thumb a lot, there is dribbling, speech and articulation problems are there also. And then the palmar reflex, that is the one where if you give a hand, if you touch the hand of an infant, a young one, he will just catch it tightly and won't let go. But slowly, by 5 to 6 months, the infant is able to let it go voluntarily, and he learns to grab and drop things like that. But if it doesn't get integrated, then the difficulties that the child sees is difficulty with fine motor skills, poor manual dexterity. They have difficulty using scissors, writing with a pen, and they might hold it too tight and not be able to do good handwriting. There is also, you see speech disorders, you see stuttering, and you might see that when they are trying to write, you might see movement of the mouth happening while they are coloring or writing. That is what we see. Now next is the ATNR, asymmetrical tonic neck reflex. This assists the baby to the birth canal and later on helps to develop cross pattern movements. So when you are crossing arms and like that, that is the ATNR, which trains the infant to do that. But after 6 months, if the reflex is still unintegrated, you see signs like poor eye-hand coordination, difficulty with handwriting, trouble crossing the vertical midline, poor visual tracking for reading and writing. So instead of tracking like with the eyes, they have to turn their head. It does not happen automatically. And also ATNR, which is retained, can lead to joint and bone damage causing scoliosis, because in ATNR, the stimulus is the movement of the neck. So if the neck moves like this, their arm goes this way, the other arm goes this way. If they turn the head this way, it goes like that. And if the one side ATNR is active and the other one is not, then the spine gets twisted. And that's how you would see scoliosis in such children. They also have difficulty with throwing and catching balls. In the school, they might have difficulty with arithmetic, dyscalculia, and then they might have difficulty with establishing hand dominance, whether right-handed or left-handed. They cannot perform that, it cannot solidify like that. Next one is the spinal galant reflex. The purpose of this reflex is also to assist the baby with birth process. In this reflex, when there is a stimulus on the back of the baby, the trunk turns. So that is how the baby is, it helps with the birth process, as well as it helps the baby to learn to crawl, because they have to bend sideways for that. This should also get integrated by 9 months. And if it doesn't get integrated, we might again see unilateral, one-sided or bilateral postural issues. Then fidgeting, such a child is not able to sit quietly and calmly because the back is very sensitive. If there is the back of the chair or the back of the clothes, labels, something, it will keep on bothering them and they cannot sit still. So that is one thing that you see. They might have ADHD also, and in a spinal galant reflex that is not integrated. Here also you can see scoliosis of spine, because if one-sided is not integrated, then every time there is a stimulus on the back, they will bend over. They show delayed cognition. So that is there. Next one is TLR, tonic labyrinthine reflex. The purpose of this is for head management and postural stability using the major muscle groups of the body. And it appears during pregnancy, and it should integrate by 3.5 years. If it is not integrated, we see poor muscle tone. So the muscles don't have a good tone. They have a tendency to walk on their toes. They have poor balance. You might see motion sickness and spatial orientation issues. So their position in space, they are not able to manage very well. Again, you will see a mixed dominance. They will do some things with their right hand, some things with the left, and they are not able to solidify that right-handedness or left-handedness. When sitting on the floor, the child may sit in a W sitting. Or if they're sitting on the chair, they might fold the legs under the chair or wrap their legs around the legs of the chair. In older children, you might see feelings of frustration and low self-esteem because they cannot perform well. You might see reading comprehension difficulty with the TLR, which is unretained. They are disorganized, forgetful, speech disorders may be present, and ADHD may be present also. Next one is the Landau reflex. The purpose of the reflex is to assist with posture development. It appears by 4 to 5 months of age and should be integrated by 1 year. If it is not integrated, you will see poor motor development. And they have balance and coordination disorders like hopping, jumping, skipping. They have difficulty with that. Behaviorally, they would seem like not being assertive. They show procrastination, being late for everything. And psychologically, they might exhibit depression or lack of emotion. Then here I have STNR, symmetrical tonic neck reflex. The purpose of this reflex is to prepare for crawling on hands and knees. It appears at 6 to 9 months of age and should be integrated by 9 to 11. The signs of retained STNR are tendency to slump while sitting, again, poor muscle tone, poor eye-hand coordination, inability to sit still and concentrate. When you might see them crawling as a bear walking, not on hands and knees, but bear walking or hopping like a bunny. That is what we see. They also show poor impulse control, poor attention and concentration. You may see ADHD there. And then in school, and difficulty with arithmetic, reading, and handwriting. So these are like a sample of the primitive reflexes. These are 8 reflexes, but actually we work on about 20 reflexes in QRI. So Moro reflex, we just talked about it. These are the signs of the Moro reflex, and all of them might not be present at the same time, but you might see a few here and there. And when they impact the development and of the child, you know that this is unintegrated. So this is a spinal element. Why my child wiggles and squirms in the classroom. They might have ADHD symptoms. They lose focus, can't sit quietly. There is bedwetting even after potty training. Dislikes sports, hates tight clothes, slouches in chair, and might complain of back pain. So this is what like primitive reflexes affect children and might trigger anxiety, night terrors, sensory issues, integration disorders we see, and fears, different types of phobias. Now, what are some of the causes of the retained reflexes? So in children, emotional and mental stress of mother during pregnancy is there because due to the stress, cortisol is released and that affects the fetus. Then traumatic birth events like C-sections, forceps birth, vacuum, breech births. And the next one is the insufficient activity and natural movements, that the baby is not able to go in the house everywhere for whatever reason, for safety or for what. They might be in a baby walker so that they cannot see their own feet and their legs, but they are still able to go around. But that restricts the natural progression of movement, like from rolling to crawling to sitting to standing. They don't go through that progress. So the reflexes don't get a chance to integrate. Genetic abnormalities also cause retention of reflexes. In adults, we would see that an adult who had all their reflexes integrated get some reflexes unintegrated when they have a fall or emotional trauma, brain injuries, physical trauma, surgeries, toxins, or stress. Because the primitive reflexes, the first thing, the function of the primitive reflex is to save the person. So when you're falling and then without thinking, automatically you save yourself from falling and getting hurt very badly. You might fall, but not get hurt very badly. But in the process, one or more than one of your primitive reflexes might get unintegrated to save you. And then we might see some people after a surgery or accident or something, they seem different. They have some different problems. So it could be because of reflexes, primitive reflexes that got unintegrated, and they cannot go back into integration without some help. They need some work on that. Now, the conditions in which QRI is useful, we saw some of these in our chart where we had the reflexes, like when they're unintegrated, what problems we see. So this is all. In QRI, this is the list, what I was telling you, that these are all the reflexes that we work on in QRI. We start with Moro, then go to fear paralysis, spinal Garan, cross-section. So we follow this order because this is the order in which the reflexes get integrated. And each reflex, when it is getting integrated, it helps the next reflex to get integrated. So they are all connected. So we don't work on, say, okay, the crossed extensor is unintegrated, let's work on that. That is not how they do in QRI, because we would work from the first reflex and go through the full list. But on assessment, when we see that which reflex is more unintegrated, so we would work more on that reflex during the protocol. So this is what it is called, a protocol, when we work through all these reflexes. This is the QRI laser kit. So QRI uses light, sound frequencies, and acupuncture points to integrate the primitive reflexes, and it does it in a really fast manner and very efficient manner. And I'm still, every time I work with somebody, I'm still amazed that how fast improvements I see in the patient, and the patient themselves feel very quickly, they see the improvement and feel it. So it has got FDA clearance now. So the laser, there are 3: red laser, violet laser, infrared laser. And then the crystal matrix transmitter is the one which produces the sound. There are infinite frequencies in there, and it is very therapeutic for the body. So the sound and the light both together are very effective. And the lasers are held on acupoints. For each reflex, there are different points, and that is how we work. And that is how the reflex integration happens. Cold laser or low-level laser it has been around for about 60 years. It is being used medically for different things. And there are lots of research that has been done for wound healing, that and this I know as a physical therapist, that how it has helped patients with wound healing. Inflammation, cold laser helps to decrease inflammation and decrease pain also. It improves with general improvement of health. The immune system is also helped because as I told you earlier, the stress on the body gets decreased, and that helps the immune system also get better. Nervous system repair, there is a lot of research done with that. So neuropathies are getting cured because the nerves regenerate better and faster with cold laser. Also, it helps cosmetically to reduce wrinkles and treat acne. Even vitiligo is treated, the white patches on the skin. And recently, I came across a research that said that cold laser also helps the microbiome of the gut improve. So it helps to improve digestion too. This is the picture of mechanism of action of low-level laser therapy at a cellular level. So they have this for the near infrared light. So the photons enter the skin and enter the cell and go, the mitochondria absorbs the photons and creates more adenosine triphosphate and everything. And then it helps to get all the beneficial effects of low-level laser therapy. So yeah, they stimulate more adenosine triphosphate production and low levels of ROS, and then it creates all the beneficial effects. Yes, here is research that was done by Leisman Jerry. He is a neuroscientist, and he did this with 40 children and adolescents with autism spectrum disorder. So they tested them on the aberrant behavior checklist before they started therapy. Then at 2 weeks, they checked it again. At 4 weeks, they checked it again. And 4 weeks, they stopped therapy. And at 8 weeks, when they checked again, there was still improvement seen. And this was the control group, which didn't have much difference. This graph is for the global scale. This is for the irritability. Here is for lethargy in autism spectrum disorder. And here is the stereotypic behavior in the same ASD kids. Bonnie Brandis, she's the founder of QRI, and she has worked with frequencies and reflexes, and this is a very good book that she has written. Okay, here I have a short video to show you what it looks like and what it sounds like. That is the sound of the CMT. And if you listen to the sound carefully, you will see that it goes through 10 octaves. So like if you look at the scale on a piano, the sound begins from the lowest frequency and it goes to the highest frequency. So these infinite frequencies and the light together, they help the primitive reflexes integrate. So here I'm working on a hands pulling reflex, which is also very important. Actually, hands pulling is very important for the hand flapping behavior that we see in some kids with autism. Okay, now I would request some parents who are here if they would like to talk about their experience. Who would like to go first?
Can you come here, Sorry. I can start, Nandini.
Yes, thank you. Okay, go ahead.
Yeah. So yeah, hi, I'm Madhura. I'm knowing Nandini for last like almost 3 years now, probably. So yeah, I have a 10-year-old son with ASD and ADHD diagnosis, and I was looking for reflex integration therapy for last couple of years, because I remember my son did not have much of crawling phase until last year. He used to also open his mouth when someone touch his cheek, just like a baby. So I knew that something was wrong with the reflexes, and I happened to talk with Nandini, and she recommended the reflex integration for him. Before we spoke about QRI, I had also tried some reflex integration methods, but it was very difficult to get the ADHD child, do all the exercises. Either he would elope or he would not do them correctly. So I was worried whether it will happen properly, the reflex integration, what I was doing. So Nandini introduced me to QRI, and this was exactly what I was looking for. And I started it last summer. It is easy to do, there is nothing for the patient or the child himself to do. He has to just lie down and receive the therapy. So it is very easy to do. And then the benefit wise, I have actually listed quite a few, and most of them I have informed Nandini over time to time. So we see the sound sensitivity being decreased, and that has led to better sleep and better mood and reduced crying spells, which is like such a blessing for us. Another improvement I'm seeing is better hand coordination. Like he's able to use both hands much more effectively than before. His independence has increased. Like one of the favorite activities is making buttermilk, which he will now do independently without any spills or making any mess. And he's following all the sequence also on his own without reminding him. So increased independence, increased coordination, his attention, posture, focus, everything has improved. Also, he's able to use the scissors more effectively. He's able to cut open the wrappers very properly without ripping them or making things fall off. We see handwriting improvement. Earlier, he used to write letters overlapping on top of each other, or like write them in reverse order. But now he is able to write them in proper order and without overlapping, giving proper spacing. He's also able to copy if a sample is given to him, copy the writing, also drawing, coloring, everything has improved. Regarding the reading fluency also, we have been thinking that he's having dyslexia as well, though his teachers keep denying. And since I got a chance to work with him over last year, I'm seeing that he's still having the problem. But when I'm using the QRI constantly, I'm seeing that his fluency, reading fluency is also improving. Using the methods for the dyslexic reading, it's benefiting more and more if I'm doing QRI in parallel. I'm seeing improvement in his cross patterning also. He's able to touch one hand, say right hand to his left knee and left hand to his right knee, which was very difficult for him to do earlier. Even following simple dance steps or simple exercises, they were difficult for him, but now they are becoming easier and easier. Another big improvement we are seeing is sitting tolerance. Over the last whole year, since we had online school, I was worried how he'll sit for so long and how we will manage the entire school experience. But it was really good. He was able to sit for at least 2 meetings in a day, ranging from 30 minutes to like 1 hour. Just for the movement breaks, he would get up, but otherwise he was able to sit through, which is such a big blessing. His engagement, participation, attention, everything was good. He needed me to sit next to him only whenever there was academic intensive work and he needed help, but otherwise he was mostly independent there. Even the school staff who have seen him for like more than 2 years back, they are saying that he has improved a lot. They saw him online and they have seen him earlier in school. They see big improvement in him. Also, our QRI sessions have become much more easier now than before. His cooperation level has improved a lot. So I'm able to do the protocol rounds also faster than before. Another thing I'm seeing is the answering part. We have been working in his therapies also. So whatever work we do in therapies also gets catalyzed when we are doing QRI in parallel. So answering questions also has become accurate and prompt. Earlier, he would either not answer or give wrong answers, or I mean, he would most of the times elope. He doesn't do any of those right now. Now he's like so well with conversing and answering questions. And in general, his understanding also, we see that it has improved a lot. Whichever language we talk in, like either in our native language or English, he's able to answer in either of the languages. Also, the memory recall has improved a lot. If we ask him something which has happened in the past, and earlier he had difficulty recalling, but now he's able to recall and tell things properly. Yeah. Another thing is oral motor strength. The balloon blowing and also the utterances of cluster sounds, those have improved a lot. That is improvement in terms of speech part. He's showing willingness to learn a new skill these days. He wants to tie his shoelaces. So first of all, learning, like showing willingness to learn something new itself is a big achievement. On top of that, like he wants to tie the shoelaces and he's really attempting on his own. So I'm showing him a song which has all the steps, and we are trying to work with that because he's a song guy. He likes to sing and listen to songs. So like taking that path, he seems to be halfway there, like one knot he's able to tie now. So yeah, a lot of things I had, so I just listed them and read them out kind of.
Wonderful. So happy to hear that, Madhura.
Yes. So thanks a lot to Nandini Tai for introducing me this amazing tool, which is easy to perform and at the same time really effective. So within short duration, 1 year also, I haven't been doing very consistently because of the school and therapy routines. I wasn't able to do on most of the school days, but all the holidays I'm able to do, and now the rounds are also getting done faster. So it is more and more effective. Thank you so much.
Thanks for telling us and sharing your story. It is so wonderful to hear his progress. And it is true that because they start feeling good about everything, things start seeming a little easier. So then, like, he's now open to learning new things, and all you can continue all therapies, and they will
Yes.
get more result because of this.
Yes. Thank you so much for all your help.
You're welcome. Okay. Deepa, do you want to go next? Hi.
I'm Deepa. Me and Ashwini, the Nandini, the sister, were neighbor in Cupertino, and my daughter, younger one, she's 3.5 years old, and this time she only noticed that there are things like she has a echolali, she repeats everything. I never noticed this. There was, but I never noticed that whenever you ask, like, what is your name, then just saying that says my name is. What is the color of the flower is red. So she repeats everything. So we only notice this, repeats everything, which is not right at this age. And she introduced her. So we have done one project. I'm very new to this, just 1 month old. But and the other thing is always very scared to a new situation, new people. Then she cries for 5 minutes or so. My first visit with the doctor was very hard because as the doctor came, she was not letting her, like, she was crying. Crying. I noticed right after that visit, it went very smooth. Like, it was drastical change. I saw that she was fine with the doctor, letting her check up and answer her questions, and it was good. The other thing is, like, now I just noticed, like, day before yesterday, so I asked her, like, this flower. So now she said the flower is yellow. So that the difference I noticed, that rather than repeating the whole sentence, a flower is yellow. Then now there are more like, what are you doing? One day she was just holding the scissor and she cut my hair. So like that. So yeah, I see changes. We have done one protocol and we were just doing. So I have not done everything, but with just one protocol, I can see some. Yeah. Thank you, Desh.
Thank you, Deepa. Yes, we see improvement in her also. Hi. Oh. You are on mute. Akshara? Hi. Would you like to talk now? Unmute yourself.
Yeah. Hello. Hello. Yeah. So, hello everyone. So my name is Akshara, and I have a son who is now going to turn 6 in September. So he's diagnosed with autism when he was 3 years old, and it was very hard for us to know that he's suffering from ADHD, and we have seen that he was not communicating. So the main problems were the speech language impairment. The other thing was the social communication and the behavior. So we tried the therapy sessions with private organizations. We were trying that from we tried that for a year, and it was just like we are forcing him, or we are making him to behave in a certain pattern with the situations. And for me and for my husband, it was not like it's like that we are teaching him to behave something, and if he is out of that situation, he don't know how to behave, how to communicate, how to ask for the things. And so when we first time meet with Nandini Tai, we talked a lot about the problems we were facing and how these things were going on at our end. and she introduced us with the QRI therapies, and it was like a blessing for us because we decided to do a session with her. And I still remember the first day when we did the therapy session. And the main thing is that when my son talks, the tone of the voice is so low that it's very hard to hear what he's trying to communicate. So we were asking him, will you please repeat it again? And he was repeating, and it is become a habit for him to repeating the things. If we ask him for a certain thing, he will repeat it for twice or thrice a time. So and the speech was very low, so it's very hard for other than us to hear or to understand what he's trying to communicate. So, so when we finished our first session, we came back home, and we asked him to do some shlokas, which we do daily at our home. And we were surprised because his tone of voice was changed suddenly. He was too loud that we can hear his echo in the room. And it was like a sudden shock for us, because that day we got to know that it's not the outer thing. Something is coming from inward. Something needs to change from the inside, which will reflect from the outside. And that experience was it was very useful for us to understand the things that we need a therapy like this, which will help them to grow in a right path. And the overall session, whatever Nandini Tai introduced us, that was very useful. The therapy was addition to that. It was like his tone of voice has changed suddenly. Even after 3 sessions, now also he's talking that we are able to understand what he's telling us. Not only for us, for our neighbors, for his teachers, even they are experiencing that his tone of voice has changed. Now his language has changed a little bit. Means though we have did only 3-day session, he's now using the whole word sentences. Before that, he used to just use 2 or 3 words for communicating. Now he's using whole sentence for that, and his tone of voice had changed, and it was a huge change for us. So we are really happy with the therapy. We are really impressed with the QRI therapy, and of course, in the future, we want to take it more and more because we want to see those improvements. And thanks a lot, Nandini Tai, that yeah, you are really that therapy was really a blessing for us. Thank you.
Thank you so much, Akshara, for sharing with us all the good news. I'm really very happy to hear that he has progressed also more after we finish that one protocol. Okay, thanks for coming and thanks for sharing. Wish you all the best. Okay, now I think we have some questions here. So let me answer those questions. Okay, which is the first question here. So Aditi has asked, what is the length of time for which QRI processes are done? So as I showed you earlier, that we have the protocol in which we do all the reflexes. So it will take anywhere from 3 to 5 hours to complete the whole protocol. And we can split it into 3 days and do a part of the protocol every day. And depending on the assessment of the child, depending on how many reflexes are unintegrated and the severity of the reflexes. At that time, I could tell you approximately how many protocols would need to be done. Okay, I hope this answers your question.
Hi, Nandini. This is Aditi. Thank you.
Oh, hi, Aditi. Yeah.
Sorry, I was cooking earlier and didn't have a chance to say hi. I wanted to quickly ask you, is there a difference from like one protocol to the next, or is it just a repetition of the same protocol?
Yeah, the protocol would be the same because we need to work on all the reflexes. But depending on the assessment, we would spend more time on the reflex that needs more work. The one that is more unintegrated, we would spend more time on that. But otherwise, it is like that. And then depending on the progress we see, there are other protocols also that can be added later on. But first, basically, we have to do the basic protocol, which covers all the primitive reflexes, because that is the real thing which will give you progress. But then there are like brain balance protocols, so that there are areas of brain that we do. But that would come later. First, we would just do this. And in my experience, I have seen that even doing the basic protocol gives very good results in children.
That's great. Thank you. I guess my next question is, this is such a groundbreaking and new therapy. It's really, we haven't heard about it before. So I think, I'm sure other parents are also, because I reached out to my OT and asked her, she had never heard of it. And she's quite experienced. So I think my question then is, how long have, whenever a new protocol or a new methodology comes along, there are trials done, research trials done. So I guess what I want to understand is, what has been like the size of the groups of trials, and how old and how long have these trials run to see, what happens, how does the child evolve into an adult over time? And if the, if the protocol has any side effects over time, have those kind of studies been done?
There are no published studies if you're looking for journals, but then that is very different. QRI has been around like for 10, 12 years now. And I have been working with it for 2-3 years. And the QRI has the low level laser therapy, and that has all the benefits. It is very beneficial. And as I said earlier, FDA has approved of this. So they had to give like 5 years, they had to give a lot of case studies to FDA to approve it. So yeah, there is FDA approval, if that is what you're asking.
Got it. If it is FDA approved, is it covered by insurance?
That insurances, I really don't think so, because yeah, it takes them a long time.
No, I understand. I completely understand. Yeah. I completely understand that part. Yeah, they're always like good decade or two behind in these matters. But thank you so much for answering my questions. I just have a quick request, and perhaps we can do this offline later. I don't want to take time from other people, but if you could share some of those case studies with me, it would be very helpful to instill confidence, and then perhaps we can continue our conversation that way.
Okay, sure.
Thank you so much, Nandini. I really appreciate you doing this.
Okay. Now, Maitreyi has a question. For how much time we should do per day, and will they regress if we stop doing it? So the time was, like I said earlier to Aditi, that in one day you might do like 1 hour or 1.5 hours, but totally you want to do one protocol which will cover all the reflexes. So you can do how much time you want. Okay, you can do half an hour, you can do 1 hour, 1.5 hours. It also depends on the assessment of the child, and it also it varies from person to person. So if I have some particulars, then I can answer how much time it is needed. And about regress, if we stop doing it, no, I have not seen regress, anyone regress so far. So like right now, what you heard, even after doing one protocol, they made a lot of progress, and there is no regression because the reflexes are getting integrated. And as the reflexes start getting integrated, the child or the person, the adult, they will do more and more movement because it is easier for them to do it and because it feels good to do movements. So after doing the movements, there is more progress because more reflexes will keep on integrating. Like when you see in a little child, in a little baby, once he can roll, then he will keep on rolling and rolling everywhere all over the floor. And then that will help the reflexes to integrate. And then the child will be able to sit up. Then he will be able to crawl. So that is actually sort of the theory that once you start integrating the reflexes, they will work on each other and it is like a chain and they will continue getting integrated. Okay. Maitreyi, do you have any question connected with this? Okay. I have Seema here. How do you get these therapies? So I am here in New Jersey and I do offer the QRI therapy for kids and for patients. But I don't know which state you are from. So you can, if you reach me, I will be able to tell you more. Okay. Indu, hi Indu, is as asking about older kids. So yes, it definitely works for older kids too. I have worked from 3-year-olds to 83-year-old patients, and it works for everybody because the system is the same. We have reflexes that we work on, and we use the different, we use the same things, and it works on everybody. Oh, Seema says that she's in Pittsburgh. Okay, let me think and I will get back to you. If you can send me an email or a phone call, I will be able to get back to you about that, okay? The next question from V, is there any data showing the most success anyone may have seen with QRI after, say, a number of regular protocols? I can just tell you from my experience, from all the patients that I have treated so far, that there has been a lot of success. And if you want to join their Facebook page, there are plenty of testimonials from parents and therapists on the Facebook page for QRI, and you can see that. Fayaz, if you get in touch with me, I will definitely talk with you about it, okay? Because I would first do the assessment and then we can decide how to work, how much work needs to be done. Okay, you're welcome. All right, so thank you everybody. If there are no more questions, then we will end here, and thank you so much to my parents who Akshara, Deepa and Madhura, who came to share with their stories about their children. Thank you so much. And I'm very happy to share this therapy with parents because that is what I believe, that we need something that works fast for our children, and that because they don't have too much time, they need to get better fast so that they can develop and more normalized every day. Okay, all right.
Excuse me,
Hi.
can you please, hi, can you please share your contact number and your email ID?
Yeah, sure. If I share it, I will share the first page so that you can get it here, okay? Okay. Okay, here it is. Do you see it, Rita?
Yeah, I get it.
All right, very good.
Yeah. Thank you.
All right.
Hi.
You're welcome.
I have a question. Just a lady earlier asked about the data and the FDA approval.
Yes.
So I just have some couple of follow-up questions on top of that. One thing is low-level laser has been approved by FDA, but also that there is no published research on it. So that's what I found I mean, typically FDA approvals would be on something that is published. So